Welcome to the Michigan Minds podcast, where we explore the wealth of knowledge from faculty experts at the University of Michigan. I'm Jeff Karub, a writer and public relations representative for the Michigan News Office. My guest today is Pamela Herd. She's the Carol Cohn Professor of Social Policy at the Ford School of Public Policy and a faculty associate at the Institute for Social Research's Population Studies Center. Her research focuses on inequality and how it intersects with health, aging, and policy. Glad to have you on Michigan Minds, Pam.
Thanks so much for having me.
I want to kick off with a question that's been all over the news for more than a month: the killing of a healthcare CEO on a Manhattan sidewalk. It has become, in the words of Philadelphia Inquirer columnist Will Bunch, a stunning moment of clarity about the state of American society. I'd like to ask you what Will asked his readers. Why did it take an assassination to raise an issue that was ignored in a presidential campaign?
So let me preface this by saying that vigilante justice, which is one way to think about what happened, is never okay, right? Like the killing of the murder, assassination of the United Healthcare executive was not okay. But that said, people's reactions to it and the kind of depth of the anger that we heard from people in response is, I think, a pretty strong signal that something is fundamentally broken in how we deliver healthcare in the United States. And that's what it really tapped into. People are incredibly frustrated in the U.S. healthcare system. We spend enormous amounts of money paying for healthcare, both individually out of pocket as well as aggregately in terms of the federal and state budgets. And people just feel like they're not getting their money's worth, right? If you have any kind of illness, significant illness, or any kind of disability, or you have a family member with a significant illness or disability, you really struggle just accessing basic healthcare services that were promised to you when you signed your health insurance contract and when you pay your premium every month and pay your copays. In essence, people are struggling to access the sort of basic healthcare that they were promised. And it's really scary, right? There's a story going back a few years now that's actually about the Medicaid program, which is a poverty-based, not just a poverty-based program, but a program that covers millions of low-income and even middle-income Americans at this point. And the gist of what happened is that people in the state of Tennessee who were on the Medicaid program needed to show that they were still eligible for the program. And the way that Tennessee ran that process meant that they changed a bunch of the ways that they changed a bunch of the practices that people needed to engage in to keep their Medicaid coverage. And so a lot of people, for example, just didn't receive the renewal form, though, in the mail. And then even if they filled it out, if they didn't do it exactly right, Tennessee canceled the coverage. And so there's these stories in the newspaper about, moms showing up at a physician's office and realizing that their health insurance coverage had lapsed. A story in particular of a little boy who showed up who had cancer and shows up at the doctor for his regular visit because his cancer's in remission, and realizes that they can't access health insurance coverage. It takes them 2 years to get the coverage back. In the process, they ended up with a second mortgage on their home. And in fact, they were still eligible. They were eligible the whole time. That kind of encounter, whether it's that or whether it's someone with a private health insurance plan being told by their physician that they need a certain cancer treatment, and then the health insurance company tells them that they can't have it, even though it's very clear it should be covered, and they spend 3 weeks, months fighting with them. Those kind of interactions people are having all the time, and it's frustrating and it's scary, and it's been getting worse over time, especially over the past 5 years. We know private health insurers have been engaging in these practices more aggressively around just simply denying a lot of access to care that people are supposed to get. So people are overwhelmingly frustrated, and they're scared, and they're lashing out. And I think that's one way to look at what the response to the assassination is, that people are scared and frustrated, and they're not seeing the government do what it's supposed to do in terms of regulating private health insurers, as well as themselves in programs like Medicaid or Medicare, to just do what people are asking them to do. And so I think that's where that anger and frustration is coming from, and why we saw the response to the executive.
You help lead the Better Government Lab, which is a collaborative research center at the University of Michigan's Ford School and Georgetown University's McCourt School of Public Policy. That lab, which like you is new to Michigan, aims to break down administrative walls and boost access to social safety net programs. Can you shed some light on how issues like barriers to healthcare inform or reflect on your work?
Sure. So the point of the Better Government Lab, which is a collaboration actually between both the University of Michigan and Georgetown University, is to improve access to government services, kind of by and large. And a lot of the work we've done has focused on improving access to different kinds of social welfare policies that people are eligible for and need, but struggle to access in practice. So Medicaid, for example, covers millions of Americans. 1 in 2 of every burrs in the U.S. are covered by the Medicaid program. It's a huge program and has a large impact on population health. But a lot of those eligible to receive Medicaid coverage struggle, in fact, to do it because of complicated paperwork or confusing documentation or a failure of the government to even notify them, for example, that they need to, once they're enrolled, that they need to actually continue to show that they're eligible for coverage. So there's a range of different kind of administrative barriers that people run into that impede their access to that program, and then consequently, right, like their access to actual health care. And so our lab is actually really focused on how do we help programs like Medicaid or like the Supplemental Nutrition Assistance Program, which provides food assistance to millions of Americans. How do we ensure that those programs, which are designed to improve health, designed to improve access to nutritious food, ensure that they're actually doing what they're supposed to be doing, right? So if the goal of that program of Medicaid is to improve access to healthcare coverage, but because we've designed complicated forms and unnecessary documentation requirements, people aren't actually accessing benefits that they're eligible for and need, there's kind of something broken there. And so our lab is really focused on working with the folks that implement these policies to fix what's broken.
What's the way forward with a complicated healthcare system and a restive, polarized electorate? Can you see any clarity amid the political and societal chaos right now?
So that's a really big question, right? Because the U.S. healthcare system is incredibly complicated, more so than most other wealthy countries kind of analogous to the U.S. And one of the consequences of all that complexity, of the fact that we get health insurance through our employers or through the government through programs like Medicaid and Medicare, or after the passage of Obamacare, through these kind of more regulated health insurance markets. It's a really, really complicated system. And it's complicated for people to really navigate that system as well. And so I do think one of the more kind of low-hanging fruits that could be addressed is using regulations to reduce some of that complexity for people and reduce the kind of negative interactions that people have with their health insurance companies. Honestly, whether that's the government via Medicaid or whether that's like your employer-based plan, we can make it easier for people to navigate. So to go back to the denial of services for people in health insurance plans, for example, we should be doing a much better job. The government should be doing a much better job of regulating private health insurers to make sure that they're not gratuitously denying people access to health insurance coverage and requiring people to go through, to file appeals and to spend 20 hours on the phone arguing with a health insurance company, either physicians on behalf of patients or patients themselves, to access services that they're supposed to be provided, right? Like the anger that swelled up and that we saw after the killing of the United Healthcare executive really reflects just that anger that both the government and the private sector are not doing their jobs properly. And so that's something beyond much more expansive political solutions like broader expansion of health insurance coverage or, single payer systems. That's just like basic regulatory fix to make companies, to make the government just deliver what they promised to deliver in their contracts is something that should be happening and that we're certainly capable of doing.
Bipartisan, nonpartisan, it shouldn't matter, in other words.
Yeah, exactly. In many ways, a lot of this are like regulatory fixes. And what I think is sort of interesting about it is whether you're a Republican or a Democrat, or regardless of your ideology, I think most of us can agree on if I sign a contract with my health insurer and they say they're going to provide coverage for my cancer treatment when I've been paying my premiums, I've been paying my copays, I think we can all kind of agree they should have to do that. And they shouldn't be like randomly denying people coverage and deliberately making it hard to kind of pad their bottom lines. And that's what they've been doing. And there's a lot of evidence that they've been doing that. So again, I think regardless of your political ideology, most of us would agree that that's not okay. And we have tools to fix it too.
To wrap up, can you talk a little about your journey to Michigan and what kinds of things you and the Better Government Lab might have in store for this year, 2025 and beyond?
In many ways, I moved here at the beginning of the fall, but I've long actually considered the University of Michigan kind of another home. I spent 20 years ago, I did a Robert Wood Johnson Foundation postdoc here. And really, it was here that I developed an interest in all the things that I love doing now in terms of both research and teaching. So it felt a little bit like coming back home. So delightful to be here. In terms of moving forward, we're really excited of some collaborations that the Better Government Lab is engaged in. We recently received funding from the Gates Foundation to do a wide variety of projects that focus on what I mentioned earlier, which is effectively just trying to fix the delivery of social welfare programs, to the delivery of benefits and social welfare programs, to ensure just that they're doing what we promise that they do, that we ensure that for people eligible for those programs, that they're delivering proper food and nutrition to children, that they're providing health insurance coverage that we've promised to provide people. It's just basically about keeping promises that we've made to people, and that's really what the government lab is focused on doing.
Can you give me an example of some work that you're doing with the Better Government Lab?
Yeah, so one of the programs that we do a lot of work with, or in regards to, is the Supplemental Nutrition Assistance Program, which a lot of folks would be familiar with as referenced as food stamps.
Right, or SNAP.
Or SNAP. And that is a program that provides support for people to buy food, right? 1 out of every 2 children will actually end up relying on SNAP benefits during their childhood to effectively eat. But one of the problems with the SNAP program is that a lot of people who are eligible for SNAP and need SNAP either don't get on it when they should, or actually sometimes they get kicked off it when they're on it and should still be on it. And it's really what I was mentioning earlier about just people really struggling to fulfill basic kind of bureaucratic or administrative processes. And one really simple example is that SNAP oftentimes requires people to complete an interview. So when you apply for benefits, or frequently if you're trying to renew your benefit eligibility, typically on an annual basis, you need to do an interview with a caseworker. And the kind of completing that interview ends up actually being something that ends up getting a lot of eligible people kicked off. Why? Seems really straightforward, right? Like, how hard is it to complete an hour interview with a caseworker? Well, the problem seems to be around the scheduling of the interview. So in a lot of states, what happens is that the state would mail out a letter and says, you need to complete this interview at X time on X date. But most people on SNAP have young children, and they're also working. And they're working in jobs like at, say, a Starbucks, where you have no control over your work schedule and you can't take an hour out of your workday to go complete an interview. That's a huge barrier. And so one of the projects that we worked on is a project, this is a collaboration with Code for America, which is a nonprofit group that helps states fix these kind of glitches in programs like SNAP. And what we did was evaluate an effort that the state of Colorado did to make sure that people could complete those interviews. So what they did is, instead of just simply saying, you have to complete the interview on this date and you only have like a 30-day window to complete it, instead they said they mailed out an interview date and time. But what they also did was sort of say, but if this doesn't work for you, you can actually just call up and either schedule a different time or just do the interview when you call. And that very small difference, what seems like a small difference, had a huge impact in that what we saw was, not only did we see a substantial increase in the rate of people completing those interviews, we also saw a substantial increase in people actually getting on to the program who are supposed to be on the program, who are eligible for those benefits and need those benefits. So this is one really simple example about the kind of work that the Better Government Lab engages in to kind of try to improve access to these benefits and services.
That's great, Pam. And thank you for listening to this episode of Michigan Minds, produced by Michigan News, a division of the university's Office of the Vice President for Communications.